look who's there. Good morning, Dr. Rosensweet.
Good morning, Carolyn.
I'm seeing that you're looking really, really well. You had suffered a little bit of influenza, um, that you said you were grateful for, that I love, because now I'm going to be grateful for every cold and flu I get from here on in. So, welcome, 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 and always welcome to the women, the gentlemen, the cats, the dogs, everybody who comes up on our show. It's great, and thank you always for the wonderful answers to the wonderful questions we get. Let
I know
me.
there's cats on our Facebook Live. Are there dogs on our Facebook Live?
Well, there are, but they are way more well behaved. I'm
Is
like,
there, in other words, we should be inclusive and not exclusive and include some questions about dogopause.
oh, catapause and dogapause. Highly, highly, highly sought out questions. And all mammalopause, whaleopause, fishapause. I've wondered that forever. Do whales go through menopause? Not one of my questions for today, but I do wonder that.
Hmm.
They don't seem to show it if they do. That I can say. So, question number one. Interesting question. Can you explain, Dr. Rosensweet, how it is the oils make it through the skin and into the bloodstream without fillers or carriers? My doctor tells me that these carriers are extremely important due to the ingredients in them, important so that the gel or cream or patch or whatever will work and be effective. He says these ingredients are what make them absorb through the skin barrier. And this too includes lotion, soaps, etc. And I am very confused about this.
Yeah, another excellent question. Um, we tend to think of classically the skin as a barrier, and it is. It's a pretty good barrier around sticks and stones. But not anything that dribbles and drops on it.
Right. Bones don't do too well with the sticks and stones, but the skin can handle them.
The in fact, there's so many things that absorb into the skin. It's rather outrageous. So when you're walking through a mall and there's chemicals in the air, some of those chemicals land on the skin,
Yeah.
or things absorb through the skin,
It's like
and
a
some things absorb more equal than other things. Like if you rub lard on your skin, or if you rub bacon on your skin, you're not necessarily going to get a ton of bacon fat showing up in your bloodstream, but you'll get something.
yeah.
The skin absorbs. And then I am going to challenge what this questioner has been said. I have a different opinion
Been told, you mean, like from the
as
doctor?
far as what it takes to get things to absorb.
Mm.
And one thing about the gels and the creams, it does take something powerful to get them up into solution. Solution is when something dissolves.
Right.
Now, if you have warm water and you put some salt in it or some sugar in it and you stir it, although initially you may see the salt and the sugar as crystals, within a very short period of time, you're not going to see any crystals in there.
Right.
In fact, chemically, those crystals are going to change form and they're going to show up and disperse 100% equally throughout that warm water solution. And you will not be able to identify them as chemicals. And if you took a sampling anywhere from that cup that you dissolve the sugar into, the concentration of the sugar dissolved is going to be the same everywhere in that cup, whether you're scooping off the top of the cup or you dip down into the bottom of the cup and draw a sample from that, or the middle of the cup or the edges of the cup. That's what
It's
solutions are. They're a uniform dispersal of molecules within something called a solvent.
right.
Water is a solvent for a ton of stuff. Things dissolve in water. Things also suspend in water. So when you go to a pond, there's things that have dissolved in the water and there's things that are suspended in the water. And you got to stir it a little bit to see the suspension. Suspension is not it's not a sustained uniform dispersal. It happens when you stir it. The particles will go up into suspension and they're evenly distributed throughout whatever the solvent is, whether it's pond water or drinking water or whatever. And we're really talking about the subject of solutions and suspensions. And whenever we're talking about one molecule of anything dispersing or being drawn into molecules of something else, we can think in terms of what's the solvent we're talking about? What's the solution that things are going to be drawn up into? In my first example, warm water, sugar, drop the sugar crystals into the warm water. The warm water is the solvent. And the sugar crystals are the gosh, the name given to these is I apologize. I don't know the exact name of what the crystals of sugar are considered, but the water is the solvent. And again, a ton of stuff dissolves in water. You take a food dye and you put a drop into a clear glass of water,
Right.
and you swirl it a little bit, it's going to disperse uniformly throughout that whole glass. Disperse uniformly. That's pretty wild. It's going to go in a solution, and it's
Like that.
every place you sample it, it's going to be the same concentration.
Correct.
And again, some things dissolve much better than others. So, for example, if you have a cup of warm water and you drop a rock in there, it will dissolve, but
Eventually.
it could take a couple of centuries for it to dissolve, but it will.
What about lard?
If if you powder the rock, if you crush the rock and crush it into powder, it will dissolve much quicker, maybe in an hour or maybe in 10 minutes.
Right.
And it's physics are at play here. And that crushing phenomena, you're exposing the much more surface area of whatever it is you're trying to dissolve to the solvent. I'm getting technical here. What about lard? And it's a different thing
Well,
because you can divide the world now when you're talking about solutions into water soluble and into something called fat soluble.
right.
And that's what you're heading towards most likely. And water soluble is a lot of stuff. B vitamins, water soluble, vitamin C, ton of stuff, water soluble. Some stuff not water soluble. CoQ10, it's an oil, it's a fat, doesn't dissolve in water. Your salad dressing, oil and vinegar, it doesn't dissolve. The best you can do is when you pour a layer of oil into a container and then you pour vinegar on top, that vinegar does not go into solution there. You can shake it. The vinegar is water soluble. The oil is fat soluble. You can shake it and you can get a temporary dispersion called a suspension, and that's your salad dressing. Your salad dressing, if it's got oil, which is oil soluble, fat soluble, and vinegar, which is water soluble, and you're putting those two things together, you have to shake it up to get dispersion. You can pour oil on the surface of a pond, and it's going to stay on that surface. the the horrendous BP water oil spill in the
Oh,
Gulf of Mexico when I lived there. It was just horrendous.
oh,
That oil just lived on the surface.
God. Oh, yeah.
It doesn't dissolve. The oil doesn't dissolve into the water. And so now let's still recovering. Let's talk about things that you can put on your skin. You can put a lot of water stuff on your skin, and some of it's going to absorb. The skin is an absorbent surface. Young, healthy skin absorbs better than older, dehydrated skin. And another thing that can dissolve on skin is oil soluble, fat soluble stuff. So you can rub some skin creams and some sunscreens onto your skin. And you rub it in, and it's pretty greasy when you first rub the sunscreen on, but after a while, it feels like your normal skin again. It actually absorbed into your skin. And it was a cream, it was fat soluble. And the skin is capable of receiving fat soluble stuff. So, for example, if you rub a pure oil on your skin, like olive oil, rub olive oil on your skin. When you first rub it on your skin, it's going to feel a little oily, but you keep rubbing, or you just give it time, that olive oil is no longer going to be greasy or oily. You're going to feel your dry skin again because that olive oil absorbed through your skin. So I'm recommending a whole new style of eating. This is one of the things I'm learning from today. And for example, if you ever go to a restaurant and you want to have a salad, or you make a salad for yourself, eat the pure salad and pour the salad dressing on your skin.
I figured that out long ago. I was 3.
It's a new way to eat salad. You'll get the dressing, but you don't have to go to the trouble of pouring the salad dressing onto the salad.
Forget it. Doesn't matter. You'll get it enough.
You'll get it maybe not at the same timing as the salad hits your palate.
That is so silly.
So I don't know how good my idea is, or how far it's going to disperse in the culinary world.
That's a good one. We'll ask Julia Child.
But it isn't, yeah, right. But it is an idea.
It's a good
Well, case in point, things that you put on your skin absorb into your skin. That sunscreen, and read the label of the sunscreen that you're applying on your skin. You're going to see some names there of chemicals that you may not recognize because they're chemical in nature. A lot of my friends, they won't dare put sunscreen on their skin because they don't want the toxic chemicals that are in there.
Or their children.
Or their children.
Little ones.
There are ways to protect you from the sun, but they're not necessarily putting these chemical sunscreens on there. And when I was in the 50s, you're way too young for this, so you'll never remember this, Carolyn Shapiro.
No way. I was.
But there was a product called Mantan.
Mantan?
Mantan. And you squirted it out of a spray bottle onto your skin, and it gave you an instant tan. Think about that one. Now, I was savvy enough when I was 15 to go, I'm not going near that stuff. I don't need a tan that bad. Mantan. Look it up, folks.
We're all going to do that.
Far be it for me to drift around the subject matter. Now I want to address head on. There's not complete information about the importance of what creams and gels are.
Aww.
Thank you, Shalima. I had one of the happiest birthdays of all times.
Happy birthday, Dr.
Yeah. There's an inaccuracy. Steroid hormones are they're fat soluble. All the hormones produced by your ovaries or a man's testicles, most of the hormones produced by the adrenal glands, the thyroid hormones, these are all fat-soluble things. They don't dissolve in water. So when you go to make a preparation of hormones, you can't just put them in water. They're going to be like salad dressing. They're not going to dissolve.
Right.
They're fat-soluble. In fact, they are lipids. In fact, they derive from cholesterol. And cholesterol itself, it doesn't float around in your bloodstream because it's not dissolvable. It has to be carried by carrier proteins. That's a whole other subject.
Right. Yeah.
And so, how do drug companies prepare these? In counted compounding pharmacies prepare these, because one thing we know that the state of the art, the safest and most efficacious way to administer estrogen to a woman, or testosterone to a woman, or testosterone to a man, is topically. That's a whole subject unto itself. So when the when the original physician, Dr. Jonathan Wright, and the original compounding pharmacists, both about the same time in the early 1980s, decided to do the best thing possible around administration of ovarian and testicular hormones, apply them topically. They knew that they had to get them up in solution. And so they used solvents to get them in solution. The most common solvent being used at that time to get these things up into solution was something called carbapol gel. It's a hydroalcoholic gel. When you smell it, it smells like alcohol. And it's strong because these steroid hormones not only are not soluble in water, and they're poorly soluble in fat-soluble solvents. You need strong solvents to get them up. You can't use weak solvents to get them up into solution. Why would you want to get the hormones up into solution? So that every time you stuck a spoon into your jar of hormones, the exact same concentration that's on the label would be there. 30 milligrams per milliliter or 2.5 milligrams per milliliter. Every time you dip that spoon in a jar. Well, now there's pump bottles. Every time you hit the pump, the same amount of milligrams of estrogen are going to come out. Or every time you click the copy click. It's very sophisticated methods of delivery. Every time you do it, the exact same milligrams of hormones come out, because when you're looking at a toppy click or a jar, over 99% of what's in that jar is the carrier, the solvent, the solution, the solvent. Less than 1% is the actual hormone. So I discovered this. So what's essential is, if a pharmaceutical manufacturer or a compounding pharmacist wants to get a fat-soluble steroid hormone up into solution, they must use a strong solvent. So these innocent creams and gels happen to be strong solvents.
Not so innocent.
And, you do the best with what you have. And, but I'll address that later. So as I mentioned on the show before, it's been about 18 years ago. The compounding pharmacist that I've been using for 10 years, bless his heart. Shout out to Tom White. Bless your heart, Tom White. In Albuquerque, New Mexico.
Aw.
If anyone knows him, say hello to him from me. I fax him in a prescription, and he would ship directly to the patients all over New Mexico. It was fantastic. I had never seen a hormone. I had been prescribing for 10 years. I had never seen a jar of hormones because they never came to me. They went to the patient directly.
Right.
And then one day, a shipment arrived that was supposed to be for a patient, but it was shipped to my office. And they came in these white cosmetic jars back in those days, and I was fascinated. Oh my God, here's a jar of hormones. I've been practicing for 10 years. I've never seen a hormone. I broke the seal and opened up the jar lid, and out came this very strong smell. And I went, wow, what's that? And I learned what it was. It was the carrier, because over 99% of what's in that white jar was carrier. It was the solvent that the hormones were dissolved into. And again, in order to get a uniform scoop, every single scoop you dip into that jar, they have to be in solution. So I did the math. At that time, I've been over 30 years a holistic medical doctor, and we're very cognizant of things that can get people ill that they have control over, and things and ways to get them healthy. And one thing that can get them ill is if they're exposed to toxic chemicals, dinosaur juice, petroleum products, for example, and the zillions of toxic chemicals that are made from it. They're great for automobiles. They're not great for the environment, and they're not great for global warming. New Mexico, bless your heart, is on fire. It just gives me grief so deep. Drying out for decades and decades, and now there's wildfires there. Dinosaurs help cars run and airplanes fly, but they don't do much good in any other way. And they're toxic to the human being. And so what I had been doing for a lot of my patients, I've been trying to help them tune up their diets and help them with the challenges of how they're dealing with the stress in their life, and helping them with exercise, and helping them with detoxifying, thus cleaning up their households and getting rid of the toxic chemicals that they're spending good money on. And I did the math, and I'm saying, yeah, I'm helping my patients detoxify. Meanwhile, when I do the math, I'm suggesting to my female patients in menopause to put a quart a year of this stuff on for the rest of their life. And the medical literature shows toxic potential in the common solvents that are being used. So what the patient was told that's correct is it takes strong solvents to get the hormones up in the solution. What was incorrect is, and this is what was incorrect, it does not take strong solvents to get things to absorb through the skin. Quite the opposite. And because, and for example, just to cut to the chase, at the time that we discovered that strong solvents, my son and I went to work, and over the next couple of years, we developed a certified organic oils base to carry the hormones. Women in the menopause method wind up getting 3 bottles of hormones: bias, progesterone, and a combination of testosterone and DHEA in individual bottles, and they're in certified organic oil, and they're not solutions. We just don't open the cap and dump it on your skin, drip it on your skin. You have to shake the bottle like this, and that puts it up in the suspension. And we've done testing on this. The suspension works for about 5 minutes or so. So if you do this and open the cap and turn it upside down on your arm, out comes the drips, and it tests out beautifully. And that's the whole story on how it tests out, because we went through all kinds of testing to make sure that the suspension worked.
It's pretty fascinating,
You
actually.
put that stuff on your skin, it's going to absorb into your body. Well, how do I know that? You take a woman who's having hot flashes and you give her these organic oils bias, and those hot flashes disappear. That's science.
It's
She's
amazing.
having hot flashes, can't sleep at night. She shakes the bottle. turns it upside down, puts it. She's getting absorption. Those hot flashes disappear. More than that, we also do 24-hour urine hormone testing. I have for 2 decades, and we see it show up in the body. Things absorb through the skin, and these hormones absorb beautifully through the skin. And pharmaceutical manufacturers eventually got hip to that. And when they were losing their market share to compounding bioidentical hormones, they started copying what the bioidentical hormones were doing. And they came up with these patches and these gels and creams. And they know that the things absorb through their skin, but they don't need the solvents to get them to absorb. They don't need absorption enhancers. That's what was untrue. You don't need to enhance the absorption of this stuff. And there's many women who've been on gels and creams that our providers tell me that when they switch them over to the oils, they got to do a little less because the oils absorb better. So the same dosages don't translate mathematically.
Right. Yeah, it makes total sense.
And you'll notice this. Anyone who shakes that bottle and puts it on your skin and rubs your arms together, within a few rubs, they're totally dry. That stuff absorbs like wonderfulness.
Like that. Yeah, it's true.
So things absorb through the skin. Caution, folks, what you rub on your skin, and do
So
the
in other
very
words,
best. If the Carbapol gel was the only tool I had on the planet, I would still be using it.
and or something that I've read about called propylene glycol. So that would be a strong alcohol solvent.
Well, there's a lot of different chemicals that are used
But
to
over
prepare
the years,
topical products, and propylene glycol is in some of them. There's a lot of different chemical names used, but they're all solvents.
yeah, and so over
Solvents
the
are
years,
strong. They're all dinosaur juice.
yes, yes, dinosaur
And if
juice.
you feel like rubbing motor oil on your skin, you probably won't be adverse to rubbing dinosaur juice. Dinosaur juice. Although I wouldn't recommend it.
How do the oils hold up in high summer temperatures during shipping?
Fabulous. One of the main ingredients actually chemically a wax. It means it doesn't turn rancid.
Mm,
That means it doesn't oxidize. So you stick
mhm.
butter out in a hot summer day or put it in a UPS truck, it's going to turn rancid. It oxidizes. It combines with oxygen. Well, over 93% of the ingredients in this organic oils mix is technically chemically a wax. It does not oxidize, does not go rancid.
Right.
And like anything that you want to be careful with, you don't stick it out in the hot summer sun. And it endures shipping because we've been shipping this stuff around the United States for the last 18 years, and we don't ever hear challenges about it getting, it'll heat up during the shipping time, but again, it won't go rancid.
Thank you for that. Thank you for the answer to that question. I know that you've taught me so well. If we put a lot of stuff, even geez, like bubble bath or whatever, can be
Yeah. What is that bubble bath? Why does it smell?
right.
Is it smelling because someone dipped rose petals in it?
I think they put man tan in it. That's what I think. Yeah, oh, that's what I think, but I'm not sure. But yeah, so you put that on your skin, you get into the bathtub, it goes into your skin. Do that time
And
and
that's why people are very careful about what they're putting in their bath water. Like they're putting essential oils in there that have come from natural sources. Are they putting some of these chemical fragrances in there that are probably not good for you? And your liver's probably going to have to detoxify them,
oh,
because if it's not a biochemical that's already existing in your body and it gets into your body's going to try and detoxify it. It's going to try and get rid of it. It's going to take up good liver energy to do that. And the livers these days, we're just whelmed with the amount of horrendous amounts of chemicals in the food supply,
I know it's really
in the
challenging.
water.
I
And
know.
in the air, the water in Florida got so polluted with estrogens, probably from flushing birth control pills down the toilet or peeing. When a woman takes a birth control pill and she pees, she's putting out hormones in that urine. That the Florida alligators, their reproductive rates went way down, their sperm counts went way down. So this is not fool around stuff. It's in the air, it's in the water, it's in the food. Go
We
organic.
have to we have to be a part of the solution somehow or another.
Yeah,
I'm sorry to go off subject, but I wanna cry. I mean, when I think about New Mexico, that
yeah.
it yeah. So, maybe we should move on to the
So
next
let's
question.
pause for a few seconds and um, say a prayer for New Mexico fires and all places that are under ecological duress on this planet. That we turn the tide on this and the fires go out. The earth heals. We're part of that healing. Thank you, everybody. Just pause there for a moment. All right. Should we go on to the next question?
Keep sending those thoughts out. Okie dokie. So, Dr. Rosensweet, how long would you say that it takes for the estrogen and progesterone to build up in one's body? And also, would menopausal symptoms increase if I've been taking them only for 10 days? Meaning all those yucky symptoms that we have, would they increase if I have been taking these hormones for only 10 days? How long should I expect for them to start working? And I think that is one of the very first questions I ever asked you, ever, but it was just put together
Wow.
differently.
There's so many different things to consider when you ask the question, how long does it take to get relief? And like all things human, there's a tremendous variability there. Some women, I knew a pharmacist that taught me this. That he said when a woman comes in to your office and she's menopausal, and you're beginning your consultation with her, right in the beginning, take out some hormones and have them rub her on her wrist. There's a certain number of women that'll feel better right away. Now, I hold that to be highly unusual
Hmm.
because by the time a woman shows up in someone's office, it's usually been days, weeks, months, years of mega duress. And just for one technical issue, these hormones are fat soluble. And while all the while that the ovaries are producing hormones, there's the hormones that distribute your body to do their thing. And then there's the hormones that are dissolved into a woman's fat tissue. And so for a while, if she's got some fat tissue, she's going to be cruising on hormones that she absorbed, but then the fat's going to get depleted because she's got no hormones other than what they can suck out of the fat. Her body can wring out of the fat. And so by the time a woman shows up in an office, it can be, so you never know.
Right.
And then we're cautious. If a woman's been without hormones for a while, we just don't pour a flood of hormones into her. That can be very stressful in itself. Excuse me.
Bless you. A big, huge collective bless you. Gesundheit.
So we start low and we gradually increase. And when a woman's been off hormones for a while, she hasn't had own ovarian hormones. Hormones work like this. There's the hormone, and then there's the receptor site in the cell. And when a hormone goes into the receptor site, that union right there, that's what creates the effect. But if a woman doesn't have hormones for a while, the receptor sites go dormant. So part of what you're doing in an initial phase of treatment, a woman whose body hasn't seen hormones for a while, is you're waking up dormant receptor sites. A little bit of afterglow from days of wild influenza.
of which you had gratitude for.
So it varies woman to woman, anywhere from you apply it to your wrist during the consultation, they feel better, to a week, 3 weeks, a month, 2 months, 4 months, everything in between. But a lot of women who are early on in the process, maybe still in the perimenopause or they're in early menopause, and we give them reasonable doses, within a week or two, they're starting to feel better. And if the process is reasonable and their receptor sites haven't gone so dormant, and we choose the right titration scale, a program, it means we start low and we gradually increase at a proper rate. Within a week or two, a woman's going to start feeling things. And so it also depends on other moving parts. How absorbent is her skin?
Right.
You apply something to a skin of a 40-year-old in perimenopause, that skin has been under the benefit of estrogen for decades and decades. It's going to be healthy. If a woman has gone 20 years without having estrogen, her skin's going to be wrinkled and dehydrated. It's going to not have the benefit of estrogens. So it's not going to absorb as fast. So I want to let you know there's some moving parts, but none of it matters. If you download and read Happy Healthy Hormones, you're going to see a path to glory.
I have seen that path to glory. What I wanted to ask you with this question, when you do take hormones, um, regardless of when it is that they start working, does that improve a woman's skin?
You betcha it does. You want to see whether, when you're walking down the street, whether a 70-year-old woman has been on hormones or not. Look at her skin.
Right.
Yeah.
It's
So,
glowing.
even along these lines, Sarah is asking the question, do you think patches work better than cream? Well, there's a hierarchy of how things work. I would put at the top of the mountain, certified organic oils are the very best by far. In our household, we use the oil base for skin oil. We not only use it for the carrier of the hormones, but we get a pure bottle of this stuff. And this oil is so delicious to the skin, it's unreal.
Yeah, the residual
It's so good.
goes right there.
But yeah, it's top of the mountain, certified organic oils. Next down, since you need to do these estrogens and testosterone for ultimate safety and efficacy topically, creams and gels coming from compounding pharmacists. Coming from compounding pharmacists. Coming from compounding pharmacists. If I failed to emphasize that point.
Would that be a compounding pharmacy?
Yes, that would be. And they're as careful as they know how to be around when you have to get something up in a solution. And then patches are a good tool. They're not my favorite, but if patches were the only tool I had, I would definitely be using patches. And if we're not able to protect access to compounded bioidentical hormones, patches might be what we're going to be left with. And gels, God help us. We'll have a lot more to say about this because we're mounting a major effort there's been major efforts mounted, and at the head of those major efforts is the American pharmaceutical compounders. They've invested close to $2 million in trying to alert American women that they're about to lose their access to compounded bioidentical hormones. This is a whole other subject, and we'll want to address this in detail in one of our Facebook Lives,
We could do
and
it
then over and
first
over
thing
again.
next week.
But we're mounting the campaign, so I'm not going to go deeper into it now. But it's not work better. The things that make things work well is, number one, how friendly is the method you're choosing to deliver to you personally?
Right.
A lot of people do good on patches. Now, in order to do good on patches, you also got to get the dosage right. It's like anything else. They're far from my favorite way to do it. You change them um, twice a week, every 3.5 days. That means when you apply that patch, you're dealing with the highest dosage, and then it dwindles, and then you reapply it. That's not physiologic. The body has no function going on every 2.5 days, and it keeps it's there's so many reasons. But you know what? If patches all I had, I'd celebrate it. But if you're having trouble with the patches, it's the dosage isn't optimal. Like, for example, Sarah's saying, I noticed when I switched to patches, I'm not getting the relief from hot flashes I was getting from cream, even with a higher dose. Well, they may not have gotten that dose high enough, because if you actually were getting relief of hot flashes from cream and you switch to patches, Sarah, type into what the highest dose patch you've been on, and type in if you know the numbers that you were on the cream. Yeah, again, patches are not my favorite, but they work well for a lot of women. They're pure estradiol for one thing. There's no estriol in there. So in Happy Healthy Hormones, we talk about the importance of estriol. So yeah, I think it's dose related, Sarah. And hey, go back to the creams. Or
Yeah.
go talk to one of our staff and find someone who's dispensing this in the organic oils.
You know,
So they all work. It's a matter of finding someone who knows what they're doing, knows what dosages to prescribe, helps you guide your process so you can individualize for your body and your absorption and your sensitivity, because all those things must be taken into effect. You know, I'm one of those guys that uh, when there's some people that when they take a whiff of something, it sort of knocks them on their butt.
it's like Daryl.
Where at the other end of the spectrum, there's people that can swallow a gallon of it and we don't even notice it. I'm on that end of the spectrum. So sensitivity to things really makes a difference. Absorption makes a difference. Individual need makes a difference. Balance between the other hormones makes a difference. There's a lot of moving parts, but there's nothing complicated about it. When you're dealing with someone who's been trained well, has the tools, knows how to use them, knows how to test you, it's just a process like anything else. And it's not as complicated as car mechanics.
Karmic. Love
It's
that.
much simpler. Take it
Well,
from
yes, well, maybe. I don't know if a car mechanic would find, being a medical doctor too simple, you know?
yeah, but as far as eventually oscillating into the right thing that each individual woman needs, the key word there is individual.
Yes.
Women must be individualized, just like men must be individualized. We look similar, and we're walking and talking and stuff, but the variation. Some women need 3 times as much as another woman,
Right.
and they're both normal. They both menstruate. They both can get pregnant. They both can be super healthy. Yet some women have 3 times as much estrogen in their body than others. Neither one is right. It's all the variation that takes place in us human beings. So we just got to find it. So
Right.
read Happy Healthy Hormones, and we describe right out of the gate how to individualize. You have that book, and you have that hormones, and you have a friendly physician or nurse practitioner that'll prescribe them. You can figure it out.
Yeah, and it
It's not
doesn't.
what I recommend. I recommend that you go to someone who's been trained and knows what they're doing and has experience. But we've got a team that's trying to put it together so anybody can do it.
It's coming, and I know that. So, actually, Siri made mention, um, uh, she says, do dormant
Yeah.
receptor I'm sorry, Tiffany. Not Siri, I'm sorry, Tiffany. Do dormant receptor sites eventually come back?
Well, that's a good question. The answer is yes. And Central Texas, we have somebody, so contact the menopause method. There's someone who's just come online in Texas. Um, the answer is yes. Dormant receptor sites are revivable. And sometimes you got to go real slow and really carefully. For a woman whose body hasn't seen hormones for 20 years, we go real slow. We're very cautious. We don't flood these receptor sites. But they do come back online. How do I know? Because you got a 80-year-old woman who's never seen ovarian hormones for the past 40 years of her life. And we start treating her with hormones and we're cautious and we move slowly. She starts getting results that she can feel and we can test. So they do come back online. How many of them, what percentage of them? I'm not sure. I mean, it's always our goal to begin treating a woman as soon as those hormones start to decline in any significant way. So the woman's hormones peak at 20, plus or minus a couple of years. They gradually decline. In their 30s, a lot of women are having symptoms. They may not realize it. That's my favorite time to start inching in the hormones, never dropping a beat.
Right.
I see that Sarah was on the 1/10 milligram of estradiol transdermal. Well, let me tell you an interesting thing that the 1/10 is the highest dosage as far as I'm concerned. As far as I'm not knowledgeable about patches, but I'm pretty sure that's the highest dose. So it's possible to take too much. Here's the interesting thing about pharmacology. It's called the pharmacological window. And whatever you're going to take, whether it's penicillin or blood pressure medications or hormones, they all behave the same pharmacologically. That means there's a range in which human beings respond, and individuals respond within that range. It's called the pharmacological window. Below the pharmacological window, you don't get the effect you want. Above the pharmacological window, you don't get the effect you want. You must get the dosage within the pharmacological window. So we're most familiar with a woman not having enough. She didn't make it into the pharmacological window as far as dosage goes. But what's is equally as true, it's just not as common, is if you exceed the pharmacological window, you don't get the effect. 0.1 is too high for many women. So here's how you find out. If you're symptomatic and you're not getting the result from the 1/10 milligram of estradiol patch, you remove the patch and see if you start feeling better. If you start feeling better, you are on overdose. So you start back at scratch, and maybe you start on the 0.05, 50 microgram patch, and you gradually increase. I know people who cut up those patches. They came up with their own fractions. I would recommend using another vehicle other than the patch because the patch has only estradiol in it. So please read our book, Happy Healthy Hormones. Perhaps you have Sarah. And at least get into creams and gels or, best case scenario, organic oils.
Thank you.
The doctor tested blood. Experts in the field of treating women in menopause, and there's very few of them out there, and we don't know what we don't know, don't use blood tests for hormones. I just got a bill from LabCorp, some blood tests we did on a patient. It's well over $6,000. We do blood tests. I tested. There's some very sophisticated testing went in there that had to do with coagulation and stuff. I love blood tests. That's my only point, but not for hormones. When did you put the hormones on last? When did you put the patch on? You got a moving target there compared to when you drew the blood. There is a way to tell in real time how much hormones actually make it into a woman's body. And it's doing the 24-hour urine hormone test, not the other urine hormone test, not the 5-point, not peeing on filter paper, the 24-hour urine hormone test. And we can tell. So, I know that there's people who are getting some success, they're getting in the ballpark by doing blood tests, but, you know, that's why I suggest you read our book. And it's too bad that you do it. You should have to, or you shouldn't. It should be valuable to you, because a woman should be able to reach out and go down to her corner, her corner, on the corner of her block, and find a healthcare provider that's very knowledgeable on this. You can probably go down to your corner or a mile away and find a cardiologist that is just fabulous at cardiology, know exactly what they're doing. And you go 3 blocks further and you find another cardiologist that was trained and is brilliant and is knowledgeable and experienced as the last cardiologist, et cetera, et cetera, et cetera, but not in menopause. So you have to do some shopping.
Doing the doctor shopping is important. I have so much gratitude that I didn't give up because it paid off, at least for me. Took a long time, but it's well worth it. And yeah, Dr. Rosensweet, you're so special in really caring so much about us women in menopause, and your team, whom I know many of, that are equally as passionate. And I really think that we're all very, very, very grateful to that. These have been wonderful, wonderful questions on the chat. I want to ask one of these here. Um, I have adenomyosis. I recently received this diagnosis. I had a consult with a surgeon who feels that I need a hysterectomy. I'm doing really well by forcing sheds and also by using high doses of progesterone. And this seems to help the breakthrough bleeding that I was having. It is under control. But Dr. R, do you feel that postponing a hysterectomy is acceptable as long as I'm doing okay by forcing these sheds and taking high amounts of progesterone? Thank you.
Um, this is far more the realm of the gynecologist. They're trained in evaluating uterine bleeding. They're experienced in it, and they've got tools to assess it. Now, most of the uterine bleeding in the perimenopause, so much of it's coming from hormonal imbalance and uterine fibroids. So there's some missing information here. I don't know. I mean, I've seen fibroids so large that I did recommend a hysterectomy. It wasn't mine to recommend. It's the gynecologist to lay it all out for the woman. Now, a lot of these fibroids, they shrink with this magical time in life called menopause, because they're no longer stimulated by excessive amounts of an unbalanced estrogen.
Right.
And that's one of the reasons you can control it with progesterone. And if you can, so you have to make individual decisions. The bleeding, 90, I don't know what percentage it is. Gynecologists know what percentage of bleeding in a perimenopausal woman is from fibroids. It's not dangerous. The fibroids are not cancer. They don't become cancer. But in 28 years of treating women in menopause, I've seen 2 cases of endometrial cancer that was cured by hysterectomy. So that's why this is out of my league. Now, your gynecologist has fabulous tools to rule out the possibility that that's bleeding from a cancer. And it goes right down into uterine biopsy, which I would totally, who wants to go to a doctor and get a uterine biopsy? However, it's a miracle that you can, because it's life-saving if it happens to be uterine cancer.
Right. Yeah,
So
you're
I'm assuming that your gynecologist has undergone all the testing needed. Gynecologists are surgeons. They love surgery. Bless their hearts. They've Back in the day when I was delivering babies, the obstetricians, gynecologists, they were a critical part of my life and my practice. And some of the special relationships I've had, special synergies that are absolutely critical, are with gynecologists and obstetricians. Absolutely. Some of them are more conservative than others. Some of them, they're quicker to remove a uterus with fibroids and not necessarily think of the possible complications of that. Others are quite willing to walk along with progesterone and menopause because menopause is going to be the cure to a lot of that bleeding. So you have to go shopping, and your gynecologist too. And you should be able to ask your gynecologist these kind of questions
Yes.
because good doctors, they care
Yes.
and they will pause with you and they like problem solving.
Yes.
They like the back and forth. They like someone says, well, how about if I went another 6 months? Am I safe to do that, doctor? And they'll say, no, not in my book. Or they'll say, yeah, it's a fibroid. I already did a hysteroscopy on you. I've already taken a biopsy. This is not cancer. This is a fibroid acting up. And I can measure that fibroid on transvaginal ultrasound. Yeah, if you don't mind going through the inconveniences and the challenges of bleeding, you're going to dry up. This bleeding is going to stop. And this is not big fibroids. Women live with fibroids because they don't turn into cancer. They don't. They're benign tumors. They don't grow once they're under, because the kind of treatment that's used for menopause, hormone wise, is, excuse me, I'm going to have to.
Bless
Are
you.
not going to make those fibroids grow because it's less than what the levels for most all women that you need as a young woman. You're running, if this is what a young woman needs, and I put it up like this, like it's a range, young women need more to menstruate, some women need less, but this is the general range between all women. We treat 95% of the women in menopause less than the youngest range. That's not going to stimulate a fibroid. So it's sitting down with your doctor, and if you have trouble talking to your doctor, that's time to move on. Who
Yeah.
likes to move on? But a friendly doctor, a loving doctor, a doctor who loves what they're doing, they will take the time.
Yes, they will.
And they'll problem solve with you because they care too.
Yes.
And now there's more and more women gynecologists. That doesn't mean just because she's a female that means she's going to be more sensitive and empathetic. But she might be.
Especially if she's going through menopause. Chances are.
Carolyn.
It's true. Really, back
So
in
these doctors are out there all over the place because there's, I don't know how many hundreds of thousands of gynecologists there are in the United States. And there's an extremely high percentage of them. They're just beautiful human beings, given so much of their life and material thinking about it.
Yeah, ditto. Me too.
And yes, there are some bad eggs. There's bad mechanics. There's bad attorneys. There's bad docs. They're not living by the golden rule.
Bad
Got other
people,
things going
period.
on. But there's a lot of good ones. From janitor in a hospital that gives so much, to LPNs, to aides, to RNs, physicians,
The cafeteria
staff galore.
workers.
Yes, I mean they're just every level. These are I get so deeply touched by people who've chosen this profession, and that includes doctors too. There's a lot of good ones out there. You could call up a hospital and you could get a grouch on the other end of the phone. That's not included in the wonderfulness. Or you could get someone that's tremendously helpful.
Makes all the difference in the world to me.
Yeah.
I can guarantee you that. And so we are. I don't know if you could go over.
No, I see
No.
it.
Well, again, a very, very happy birthday. to you.
Thank you, Carolyn.
You're welcome. Thank you, ladies. Thank you, men. Thank you, everybody. Have a great weekend this weekend. And we will be back on Tuesday and get with our questions and have a great time, as we
See
always.
you then, everybody. See you then, Carolyn.
Bye,
Bye-bye.
everybody.